Welcome back to Navigating Cancer along with Wendy Hall. I'm Dr. Joey Bennett, and today we are talking about the importance of nutrition in our cancer patients. In the first segment, we talked about a lot of physical things that can sometimes cause people to have trouble getting the proper amount of nutrition in. As we go into this segment, I want to talk about some of the other issues that we deal with that can cause you to have a decreased intake. On this slide, you can see one of them is social isolation. A lot of times people who are going through treatment have a fear of going out in public. They have a fear that they may experience a side effect when they go out in public. And so therefore, they don't want to go out with their friends. They don't want to do the things that they used to do. The mental illness there, Wendy and I were talking about, really is kind of some depression and anxiety that goes along with exactly what you were saying earlier.
Right, right. And people definitely can withdraw, and they have a lot on their mind. They don't always know if their friends and family are understanding what they're going through and things like that. And then adding a meal to it, a family meal even, or a meal with friends, is sometimes puts them over the top, you know. Right. So they'd rather avoid that.
And that's the isolationism. I mean, sometimes they would rather just kind of be by themselves and eat by themselves, but very often that leads to a situation where they're not taking in enough of it. Next on the list, NPO means nothing by mouth, and any of you who have ever undergone any radiographic type tests know that sometimes, even for blood work, sometimes you can't have anything to eat or drink from the night before. And if you're going through a lot of tests while you're getting diagnosed with your cancer and being staged with your cancer, you may have multiple days in there where you're not allowed to eat, and that can certainly lead to weight loss as well. I mean, these could be biopsies, blood tests, x-ray tests like CTs, PETs, and things of that nature. Next on the list can be just the fact that it's difficult to eat. If you've lost some weight and you have dentures, all of a sudden those dentures aren't going to fit the way they used to, and so it can be uncomfortable, if not maybe impossible, to be able to chew your food and eat the way that you used to be able to eat your food. The other thing is, if your mouth is really sore because maybe you're being treated for a head and neck type cancer, or certain chemotherapy drugs can cause you to have some irritation of the lining of the mouth, you're not going to want to really reach in there with a toothbrush and scrub as hard as you should. So you can have some problems with the hygiene, which will change the taste of foods. Now all of a sudden you don't want to eat them. And then all of a sudden, with that discomfort, with that taste, you just get to the point to where you don't want to eat. Last on the list is that sometimes patients have difficulty feeding themselves. This can be seen a lot of times in patients who have had maybe a brain tumor. And they've got some sequelae left over from the tumor itself or the surgery, and they physically have trouble feeding themselves. And if we know that, there are ways for us to address those situations. There are organizations that we can get to come into the home that can help with meals. We can get nurses' aides, we can get nurses. I mean, lots of different things we can do from a standpoint of your side of things, from the social work standpoint.
That's true, and I think maybe even more often than that, if people are too tired to go to the grocery and get food items. I know one lady told me that she went to the drugstore like CVS or Walgreens, and just that's all the shopping she did because she could get that close and in and out, and then getting something prepared. So that's the same problem as well.
Right. Another thing to look at, though, is that there are certain reasons why sometimes you require extra calories. We spent the first part of the show talking about not getting in enough calories. Sometimes you require a lot more calories because of certain situations, and here's a list of some of the most common ones. Shortness of breath. If someone has lung cancer, they may be feeling really short of breath, and with that, they're going to be working much harder to breathe and get the oxygen into their system. So all of a sudden now they're burning up more calories. If you've got an infection, your body is fighting off that infection, and that's going to require more calories for you to be able to do that, so you could lose weight from that standpoint. If you have a wound, if you've undergone surgery of any sort and you're healing up, that process of healing from a surgical incision, healing up from radiation, healing from chemotherapy, is going to require you to have a need for many more calories, and that kind of follows down with what we call post-op patients. You know, anytime you've been through surgery and you're recovering from it, you're going to burn up a lot more calories, and it's critical for you to do that. And then finally on that list are fractures. If you have happened to have fallen and broken a bone or something of that nature, as that bone is healing, Your body needs the extra calories, so if you're eating the same amount every day, you're probably going to be losing some weight because you're expending more calories every day. Other big issues that we deal with is just losing nutrients, and we talked a little bit about this earlier. You can have vomiting, you can have diarrhea, you can have kidneys not working the way they're supposed to, and now all of a sudden you're losing calories, you're losing electrolytes, your body can kind of become out of balance. You can have hemorrhaging, meaning bleeding, and if that's the case, now all of a sudden you can become anemic. And if you're anemic, you're going to feel very tired, you're losing a lot of iron, you're losing proteins from your body. So these are things that are critical to try to correct and try to keep the blood counts up. And then last on that list is a wound. If you've got an open wound of any sort, we all know that those wounds ooze and drain a little bit, and those are body fluids that you're losing. Those are electrolytes and nutrients that you're losing. So anyone who has a chronic type of wound, if their diet is not adequate to give them the calories they need for their body, that wound healing is going to be greatly slowed, because either the wound healing or the body needs the calories, and they can't both compete if you're not getting enough of the calories in.
So you're talking about calories and also nutrition. Both of them go together.
Well, I think that it's good nutrition. It's trying to eat a well-balanced diet. We've spoken beforehand that the old brown and white plate is not good. You want some color on that plate. You want some protein. But you can get protein from sources other than meat. You want a lot of vegetables, and you want the colorful vegetables, because those colorful vegetables are loaded with the antioxidants. So yes, it's important to try to eat a well-rounded, good diet, but one of the most important things is calories, calories, calories. I mean, you've got to get the calories in for your body to be able to use those. So what's the impact of patients if they're not taking care of themselves? One is, of course, weight loss, which slows down the healing process. You can run into vitamin deficiencies. You can see the immune system not working as well as it should. What I mentioned just beforehand is delayed wound healing. Any kind of wound ends up being much slower to heal. If you're malnourished, you're also at a much higher risk of pressure sores, or bed sores as we like to call them, and those do tend to be in people who are kind of protein deficient, not getting enough calories in. Your muscles can start to waste away. You start losing your tone, and with that, here comes weakness. And then you can also see a decrease in your cardiac function and your ability to move around. So the impact of not getting in calories is significant, and it covers a lot of part of our daily lives. When we come back, we'll cover more of the risk and talk about the things we can do to help.